All right. Good morning, everybody, and welcome. Today we are talking about long-acting injectables and chasing stability. My name is Anissa Wiseman. I am the Deputy Director for NAMI Hawaii. So, as a disclaimer today, I am here today in the role of a peer or family advocate, not as a medical professional. This workshop is meant to share information and open conversation about long-acting injectables and mental health treatment. Everyone's journey is different, so please remember what we talk about today is general information, not medical advice. If you're thinking about treatment options, the best next step is to talk with your doctor, psychiatrist, pharmacist, or another trusted healthcare provider. Our goal here is to learn together, reduce stigma, and empower informed choices. This workshop is for educational and informational purposes only. It's not a substitute for medical advice, diagnosis, or treatment. I am not a medical professional, and nothing in this presentation should be taken as medical guidance. For questions about medications, treatment options, or your health, please consult with a licensed healthcare provider. All right, thanks for bearing with me through that, guys. All right, we're going to start off today with a personal story. We're going to share real lived experiences. I want to acknowledge that some of the stories shared today may include experiences involving loved ones. These stories are shared with care and intention, not to expose or harm anyone, but to help others feel less alone, to bring understanding, and to break stigma. We ask that you receive these stories with respect, compassion, and without judgment. I ask of you to be curious, be respectful, and take what resonates with you. So, with that said, I'd like to invite Chris to unmute and share his story.
Hi, you guys hear me?
Yes.
Yes.
All right. Great. So good to be here. Always love these opportunities to share this story. Hope it helps. So my name is Chris. I live here in Hilo. My ex-wife, we will call her Amy. That's not her real name. She developed schizophrenia in 2017 and she refused treatment because she had no insight. Um, But she did finally agree to take a long-acting antipsychotic injection about a year ago after, 8 years of struggling with this. And now she's doing amazing, but it was very, very hard to get her help. Very, very bumpy road. We were together for 17 years, and had what I felt was a pretty solid, healthy marriage. She was a successful software engineer, had a great career. She was charismatic, smart, funny, beautiful. We raised two kids together. We lived in the US, Germany, and Taiwan, where she's originally from. And we ended up here on the Big Island in 2016. And here things were going great. But then over the course of a few days in 2017, she broke. Suddenly, she was very delusional, paranoid, cognitively impaired, violent, and barely able to take care of herself. It was awful, and it was really scary. We had a lot of police interaction. She had several hospital stays. She was homeless. She went missing. She was shacked up with drug addicts who abused her. Um, we ended up getting divorced. She demanded it. It was horrible for anyone who cared about her and anyone who cared about me or my son, Kai. He was 9 years old when she got sick. It really was just the two of us battling to save her, um, with support from my family and hers, but it was really just me mostly wrestling with this system, which wasn't aligned to help us, to help her. A lot of dealing with the court, talking to the police, begging doctors in the psych ward not to release her, begging all the local charities for help. calling every single psychiatrist on this island multiple times and begging them to help me get her treatment. Nobody did anything. The most I got was for a psychiatrist to do a telehealth session in order to get her disability approved, which I am grateful for, but then they just ghosted me after that. I got a couple of therapists to do some therapy sessions with her, like telehealth, but it wasn't effective for this kind of mental illness. It was just a chance for her to get all amped up and go off on all her delusional rants. Um, we knew she did respond to medication because we saw it during a couple of her hospitalizations. And I had heard about the long-acting injections from one of the doctors who had treated her during one of the emergency stays, but I guess they weren't as good back then, and they were a lot more reluctant to administer that back then. But I kind of wish they had, in hindsight, because the pills that they would prescribe, she just didn't want to take them. So, as soon as she was out of the hospital, she would just stop. Um, After 8 years of trying to get her help and getting nowhere, just watching her deteriorate, we were close to giving up. I mean, we were expecting her to just die, essentially, in some kind of crisis, some kind of calamity. At the end, in February last year, she was cutting herself and she had all these big infected wounds all over her legs. And we were trying to get the police to bring her to the hospital, but of course they wouldn't because they'd turn up and she would tell them she was fine and wouldn't show her injuries. Um, Kai, our son, was in his final year of high school and he wanted to go to college on Oahu or on the mainland, but he told me he decided he would need to stay here in Hilo to be close to his mom because she was so sick. He needed to be here to help me keep an eye on her. It was so sad to hear him say that. Um, so that was a real low point for us. And a couple of years ago, there was a mental health summit here in Hilo, and one of the speakers was Dr. Chad Koyanagi. And I heard about his work on the streets in Honolulu giving long-acting injections to mentally ill homeless people. And what a job to do. Um, and I was really surprised to find out that he's one of only about a dozen psychiatrists in the entire country who does that work. I tracked him down after the conference and we started emailing about what I might be able to do to help Amy. I mean, he works within the healthcare system, dealing with all kinds of legal issues, insurance issues, etc. And he's an incredible resource for someone like me. And over the course of about a year, I tried various approaches that he suggested to try to get her help, but I just kept running into dead ends, and I just felt really defeated. And then I was telling him about how she was cutting herself and how the cops weren't doing anything, and he finally just said, "All right, I'm coming." Um, I mean, just incredible. So I was just so grateful and super excited. I mean, I offered to put him up in a nice hotel here and to pay for, rental car and all his meals, whatever he wanted. But it turns out he was actually coming every couple of weeks already, doing some work for Hope Services, doing some street psychiatry here. So he just agreed to piggyback on one of those trips, even though she was housed. I ended up having to buy a house to house her, just to keep her from being homeless. So that made her essentially ineligible for those services that Hope's charter allows them to do. But he made an exception for me, for her. So Kai and I met him and two Hope Services workers at Amy's house. We didn't know what to expect. Frankly, we had pretty low expectations about it. We knew it was going to be really tough to get Amy to take the shot. She was very stubborn, very defensive, zero insight. She would get aggressive. It was just really hard being around her. So we couldn't imagine, how Dr. Koyanagi was going to help us turn this around and get her to take it. And we tried on this first visit for about an hour and a half, and she was just too guarded. We couldn't really talk to her. She was trying to chase us away. Um, we did our best, but we couldn't do it. And we thought that was it, but then Dr. Koyanagi said he would be back in 2 weeks. So we tried again, and this time we pulled out all the carrots and sticks that I could think of. I offered her cash. I offered her trips to visit her family. I threatened to kick her out of her house. I pretended to call the movers to come and move her stuff out of the house. Um, I got on my knees. Kai begged her. $1,000 wasn't enough, but when we upped it to 2,000, that kind of caught her attention. And she said, okay, as long as the woman does it, because Chad had brought a female worker with him. And so the men kind of went away and they did it. They got the medicine into her. It was like just an incredible moment. And we were just so elated. And within about a week, we noticed, significant improvement. I mean, the symptoms had reduced significantly. She was a lot less hostile, a lot less paranoid. Her delusions were a lot more subdued. She had a lot more mental clarity. She was just a lot easier to talk to. Within about a month, she started asking questions about what had happened over the last several years. It was kind of like she was waking up from a coma, is kind of the what it felt like to us. She was asking rational questions like, "Why did you call the police on me? Um, why am I here? Why aren't we together? What did I do to make you divorce me?" She was asking questions that she had not been able to ask before. And she acknowledged that life had been harder for her over the last few years, but the insight wasn't quite there. She was just starting to approach it. And we didn't really want to push it. But now she's been on the LAI for over a year. And Dr. Koyanagi and his team, they've been coming every 2 months. And she's always accepted the injection without any fuss. And we don't really get into it with her a lot about what's going on with the doctor visit. Um, but after about 3 months on the injection, she did start to have some insight. Um, she, I think I just asked her, I said, "Do you know what happened to you?" And she said, "Yeah, I have a brain disease and the medicine is helping me think straight." So, that's the best outcome that we could have hoped for. And it's just gotten better ever since. I mean, I think she's at about 95% of what she used to be before she got sick, I would say. She kind of reminds me of a friend of mine who recovered from a traumatic brain injury. She's mostly there and mostly the same, but she has like a slightly curtailed sense of humor, a little less motivation to get out and about and interact with the community. She still kind of keeps to herself. She seems kind of beaten down and tired, and I don't think it's necessarily because of medication. I think it's because she's just been through hell. And plus schizophrenia does cause brain damage. So, some of this just, you know, we can't expect 100% recovery, I don't think. But she's proactively setting up doctor's appointments. She's tidying up her house. She's dealing with car repairs on her own. She's searching for a job. She's going to church. She got a roommate. Um, in December, I sent her along with Kai, our son, to visit her family in Taiwan, and they hadn't seen each other in a long time. Some of them had come to visit her here a couple of times, but it had been years since she had seen her mom and some of her other family members, and they were just so thrilled to have her there, and it was just, a really a special time for her. and her family. And, the analogies I use to describe what's happened here are like she was kidnapped and her captors just released her. Or, she was missing and she was just found, or she was in a coma and just woke up. And that's what it's like. And we're just so thrilled. Um, we couldn't have expected this in a million years based on how hard it was and how many obstacles were in the way. Um, over the last few years, we've tried giving her a book about schizophrenia, but she had always refused to take it. And Kai dropped it off at her place a few months ago, and she told me she's reading it and she's learning a lot. I mean, you know, what better outcome could there be? And so this medicine has changed her life, and it's changed the lives of all of the people who care about her. And we're just so grateful to be here. And we're just in awe of Dr. Koyanagi. I mean, I know that he was just recently awarded the Psychiatrist of the Year by NAMI, and I think the next thing is you guys need to make a statue of him in Waikiki somewhere. He's just that amazing, and there's so many stories tied to him, so many stories of recovery tied to him. But you can't solve this problem with one good guy or 12 good guys like him. There are a lot of opportunities to improve access to treatment for people like Amy with this severe anosognosia, this lack of insight. Some of it's a resourcing problem. There isn't enough money being allocated to these solutions. Some of it's a legislation problem also. In America, we do let people with severe mental illness die in the gutter and rot away in their homes. Um, their freedom for self-agency and bodily autonomy is in direct conflict with their anosognosia. I mean, the laws aren't written with that feature of the illness in mind. So, and I don't think it's right. In terms of resourcing, we need like thousands more street psychiatrists. We need to expand programs that produce psychiatric APRNs because they can also prescribe and administer the LAIs. And we need these people to have easy access to homeless people who are suffering. So we need them to be like a regular presence at homeless shelters, food banks, the Salvation Army, etc. Um, of course, every country in the world struggles with this stuff, but there are good examples of countries even less developed than the US that have much higher recovery rates than we see here because they focus the right resources on the right issues and they have the right legislative frameworks to allow for these folks to receive treatment. So I don't think it's rocket science to improve this. It just takes more voices, more pressure on our local city, county, state, and federal lawmakers. Nobody should have to struggle against a broken system like this for years the way we did. I mean, ultimately, I feel like it's unethical to let someone live like an animal, at high risk, the way Amy had to live all those years. If there's a way to get them help and to keep them safe, we shouldn't allow it. Amy's life would be so much different today if we had been able to get her onto an LAI in the first days of her illness. I mean, until we get our act together on this, the only options we have are frankly bad options. I mean, it takes like a real fighting spirit and perseverance to deal with someone with anosognosia. And besides the NAMI support groups providing family members the support to keep fighting, which is essential and super valuable, and I'm so grateful for that. I mean, you're essentially on your own, sadly. It took me a long time to realize that, but I wouldn't have been successful without reaching that point. So, my advice, if you're struggling to get help for someone you care about, then you're gonna need to fight hard for it. And ultimately, it's gonna depend on your ability to get your hands on a psychiatrist or an APRN who's willing to to come and meet the person where they are, get out of their comfy telehealth office and get out into the homeless camp or come into your home and build a relationship with the person and use leverage um, along with you and other people who care about them and who have that leverage to make it happen. There really wasn't any other way for us. And when I hear stories similar to mine, um, that's what they've had to do as well. So I wish there were better options. And if they have some insight, there are better options. But when you're dealing with someone who really doesn't, the options are very, 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 very few. And that's unfortunate, but I know that it can be better, and it will be better, especially with increased awareness and you know, rallying the funding to focus, like I said, on the right resources and the right laws. So that's my story, guys.
Thank you so much, Chris, for being here today and for sharing with us. Chris has to leave us in a second, but I wanted to open it up for questions for him before we do. So while you guys have a second to think about a question, if you have one, Chris, I'd like to ask you, why do you think she is accepting the LAI now? Like, why does she keep accepting it from Dr. Chad?
Yeah, she's having a hard time expressing that. Um, but when she has talked about it, she understands it's helping her life be better. She's still, you have to kind of corner her and get her in the right frame of mind for her to start talking about, yes, I know I'm mentally ill and I know I need this medicine. She's really still uncomfortable dealing with that directly. So I think some of it is that she really trusts the doctor. They're very, very kind. They've built a relationship with her over a long period of time, and they don't treat her like she's sick. They don't tell her, "You're sick, you need medicine." They say, um, we need to keep coming so that you can still feel good and think more clearly. This is why your life is better. So they talk about it more in those terms, and those are things that she can relate to and she can't deny. And she will say that. She'll say, yes, since, they've been visiting, my life has been better. And so I guess, that's as good as we'll get for now. But like I said, when you catch her in the right moment, she'll she'll let her guard down a little bit, and she'll say, I know I have schizophrenia and I need the medicine.
Awesome. Thank you, Chris. Does anybody else have any questions for him before we say goodbye to Chris? We're about to get into the, uh, go ahead, Jenny.
Hi, Chris. when your wife has had the medicine, does she walk funny? I mean, does she uh, be like a zombie? Like feel like she's a zombie?
No, she's energized. She's very with it. She is physically active. Um, she looks and talks like she used to before she got sick, for the most part. Like I said, I don't think that some of the lingering differences are necessarily because of the medication. I think it's because she's older now. I mean, a lot of time has gone by. She's older. She went through a horrible experience. So, I think it's also that, and I also think like there is permanent damage there because she went a long time unmedicated. The longer you go, the harder it is to kind of climb out and rebuild all of those damaged pathways. So, I think, yeah, I mean, to answer your question, she's engaged in the community a lot more. I mean, not as much as before. She's doing exercise proactively on her own. She's eating a lot better. She's paying a lot better attention to what she's eating. She is trying to get a job, but I don't know. It's discouraging because her skills are now out of date. She's a software engineer who hasn't done software engineering for 8 years. So people don't want to hire her. She doesn't really have the money to go back to school. So we're kind of dealing with that aspect of it. Luckily, she still has her disability, so she's not in existential crisis right now in terms of like not being able to pay rent or eat or whatever. She's on food stamps. But I would say like the way she acts, the way she physically moves is the same as before. She's just a little older.
Awesome.
One more
That's awesome.
question.
Go ahead, Jenny.
Um, do you know the name of the LAI?
Oh, we cannot share the brand names of the LAIs here today.
Sorry, I'm
No
sorry,
worries.
sorry.
It's
No worries,
okay.
Jenny. Does anybody else have any questions for Chris? Brooke, did I see you had your hand up?
I just basically agree with you, Chris, on there's a lot more work to be done. And this is a major um, blessing and breakthrough. But as you know, with our current administration, it's very tough because now we're facing Medicare cutbacks and Medicaid. So there's the administrative facet of this that we're currently having to hold our breath and deal with what's coming. Um, and it's not an inexpensive drug. It's very expensive. So if we were all of a sudden left to our own devices on being able to provide this opportunity for our loved ones, we would definitely, especially my husband and I, who are in our golden years and we're retired, would be quite a feat to have to deal with. So, financially. So all I can do is just encourage everybody to keep talking to their legislators and we've got to keep advocating for this opportunity to be able to give our loved ones a new life through this drug.
Yeah.
That's all I have to say.
Yeah, they
Thanks.
say when you deal with this, you're fighting two enemies. You fight the illness and you fight the system. It almost felt like the system was set up to just make this impossible for us. I mean, I had to go completely around the system. The system never came through for us. I mean, where it did come through was she's on disability. That's not available in a lot of countries around the world. So we're very, very grateful that she has a way to survive. Um, but otherwise, and then, she's on food stamps and she's got insurance to pay for the medication. But the care that she's receiving is not part of the system. There is no one right now in this system that's going to go to her house and give her this drug. So, but yeah, fighting the system was like, you feel like, oh, you've got this horrible situation. Well, of course there's going to be help. And when you realize like you're on your own, it's devastating because you're like, wait a minute, I'm paying like X amount of my income to in taxes for stuff like this. If if there's nothing there, like what kind of country is this? So it was very, very eye-opening that way for us. And yeah, we had to come to the point where it's just like, well, these are all dead ends. There's no one coming. And we just had to get really creative. And unfortunately, that's what it takes. But I think if I had reached that point earlier on, it would have gone a lot better.
Yeah. All right. Any other questions or comments for Chris before we say goodbye to him? No? Okay. If you have any questions for Chris that come up later, please send us an email at info@namihawaii.org and I can forward to him and give you his answers. But Chris, thank you so much for being with us here today.
Thanks,
I
Ash.
hope you have a good rest of your day and we'll talk soon.
Thanks so much.
All right, so we're going to get back to our PowerPoint here, and we're going to actually learn about LAIs and what they are. So I'm going to pass it over to Kaylee. Kaylee, will you introduce yourself for us?
Hi guys, my name is Kaylee. I'm going to be talking with you guys today about LAIs. I've been working with Anissa a lot, just in all learning about all of this, and I'm just very excited to be here with you guys. So we heard from Chris, and it may have been a little confusing if you don't necessarily know what LAIs are, but we thought that would be helpful to hear his story and hear how impactful LAIs have been prior to learning about them. So they are long-acting injectable medications, and LAIs are usually given to treat psychosis, hallucinations, or delusions in individuals with schizophrenia. Some LAIs may be used as mood stabilizers in individuals living with bipolar disorder as well. The difference from oral medications is that the LAI is taken less often, but it is the same active medication. So there's multiple types, and they correlate very closely with the oral version. This medication is administered at a clinic or by a provider, and the dosing options range from every 2 weeks to every 6 months. So it is that long-acting formula. And the common conditions treated with LAIs are schizophrenia, schizoaffective disorder, and bipolar disorder. So LAIs are given as an injection in the muscle of the arm or the bottom, or it can be given underneath the skin, so subcutaneous in the belly. It works by slowly releasing that active medication from the site of injection, and it helps to keep that medication level therapeutic. So LAIs are dosed differently and work a bit differently from pill medications, so providers would usually start someone on LAIs only after knowing how they respond to the pill version. That way the pill allows the injection to have time to start working, and this is called bridging. Depending on the LAI, it can last anywhere from 2 to 24 weeks with just one dose, making it beneficial in controlling symptoms of mental illness without having to take the daily pill.
Thank you, Kaylee. So let's talk about the history and the stigma of LAI. So in the past, LAIs were known as depot shots, and they had harsh side effects, which created fear. And it was also often tied to coercion or forced treatment, which, you heard from Chris earlier how, Dr. Koyanagi is going out and he's doing his work and he's not using coercion or forced treatment. Everything is done with trust and building that relationship and with care. The other thing is that in the past, it was oil-based, and so sometimes it would be painful for other people when they would have it too. So the side effects were difficult to manage. Today, there are safer formulas, more choices, and more respect for autonomy. So modern LAIs are tools now and not punishments. My mom, she's diagnosed with bipolar disorder with severe psychosis, and I would often have situations where I would have to involuntarily commit her, and I had no idea that LAIs existed. Oftentimes it was because she came off her medication and I didn't know it. And if I would have known about LAIs, then I could have advocated for it with her. I do not think that they are the only path, but they are a path to recovery, and I think it's important that we know about every single path there is. So why LAIs? Who may benefit from taking LAIs instead of pills? People who want medication treatment but forget to take the medication or cannot take the medications regularly because of their circumstances. So these are like houseless individuals, or even we're all human. Have you ever not taken all your antibiotics like you were supposed to? I definitely have. And I think it's the case for a lot of our medications. Like we have to remember to take our blood pressure medication or a cholesterol medication or whatever. And, sometimes we skip a dose because we're human and we can't always remember. People that have trouble swallowing pills, people who tend to be sensitive to dosing of the pills and need a more consistent delivery of the active medication, or people who may have higher risk for overdosing from the pills as well. Why this matters now? Because medication adherence is one of the biggest challenges in recovery. We think they're medication resistant, but oftentimes it's just that they haven't been taking their medication. There's stigma and misinformation that keep people from their options, and there still is a lot of systemic barriers like insurance, access, lack of awareness, a lot of the things that Chris talked about in his story earlier too. So there are advantages and disadvantages to LAIs. Consistent use means less likely for relapse and hospitalization because you have steady level of the medication in your body. And that also means less likely for overdose or side effects or underdosing, relapse. Like I know sometimes with my mom, um, sometimes she's just having a really rough day because her hormones are elevated or whatever the case is, and she can't remember if she took her pills or not that day. So like sometimes she might overdose herself accidentally because she can't remember if she took her pills or not. Or sometimes she might miss because she thought maybe she did take them. It just depends on where her hormone levels are and how she's feeling, whether or not she can remember. You have more freedom from not being tied to daily pill routine. Many peers report feeling more themselves and less stress, just like Chris talked about Amy and how she's doing now. It supports autonomy when chosen collaboratively and with providers. So, collaboratively and with providers. And you're getting this at the doctor's office, so you have more regular appointments with a healthcare provider. The disadvantages are that the injection may be tough for people who have sensitive skin or find them too painful or struggle with needles. You may have to plan travels or activities around your appointment for the injections, but actually, we're finding that people can actually go on vacations now because they're on the LAIs. Like, Chris talked about how his ex-wife Amy and his son got to go on a trip finally for the first time in years because she's on an LAI. LAIs may be more expensive than pills, and there are sometimes some of the drug companies will help with that. So if you are totally struggling with resources in that way, there is a potential path with that. If you're having side effects from the medication, it's hard to adjust until the next injection because you are on it for so long. And that's why it's also important that you have the pill before you take the injection. But sometimes for houseless individuals or people that have been in crisis or stuck in psychosis for a long time, it's not an option to give them the pills first. Sometimes you have to start on the injection first. And for the reason above, providers tend to start people with lower dosing, so it may take a while for you to dial into the right dose. Just like with any medication, like if you take an antidepressant or whatever else, there's adjustments that happen within there. All right. Despite some disadvantages, such as cost and time it takes for the medication to work, LAIs can help individuals stay on track with a medication plan. If someone is having trouble sticking to a plan, many things may happen. One problem could be needing to stay in a hospital until the illness is better. Other problems may include trouble with family and friends or other relationships. When comparing LAIs to oral medications, they have lower the chances of someone going to the hospital since LAIs allow for a steady level of medication in the blood. So less relapses happen on LAIs. These steady levels help lower the chance of side effects, and they also help improve quality of life and satisfaction with medication treatment. And again, not just for the individual, but for their family and friends as well. When it's not just the individual that's sick and is in crisis, it's the families and our communities are struggling with it too. So how to start the conversation with curiosity, not pressure. If interested in an LAI, talk to a doctor. An LAI may not be right for every person living with mental illness. And when talking to a doctor, here are some questions that you can ask. How could an LAI help me? Which LAI would be best for me? Jenny asked earlier, like, oh, which medication was Chris's ex-wife on, Amy? And the reason that we don't share branded medication names is because everybody's brain chemistry is different. And so the LAI that may work for somebody like Amy may not be the same LAI that may work for you or your loved one. What symptoms will a LAI control? And what side effects may happen because of it? And what blood work will need to be done? And sometimes you have to do blood work often, so ask how often you might need it. So they should be part of a whole wellness plan. That means therapy, peer support, housing stability, not just the plan. They need to be a part of the plan. So some takeaways before we move into our the rest of our stories. LAIs are medications made to help individuals living with mental illness. They may help to reduce time in the hospital and may improve quality of life. They are injections that are given every 2 to 24 weeks, depending on which medication is best. and this schedule may help individuals stick to a medication plan. For individuals worried about paying for a LAI, help may be available. Many insurance plans cover the cost of at least one of the LAIs, so one of the different brands, and the drug company for each medication may also be able to help. All right, with that said, I'm going to go ahead and pass it over to Brooke for her to share her story. Stop sharing. You're muted, Brooke.
Hi, my name is Brooke, and I have been a member of NAMI for, gosh, almost a decade now, and just started to volunteer once my husband and I were more aware of what we were dealing with our son, who has the serious mental condition, that it took us at least 5 years to figure out what was going on, and a lot of confusion, a lot of what Chris was describing. And then when we finally got help through NAMI, being educated, being a part of the support groups, the family to family 8-week course, understanding medications and the different illnesses, we were enlightened. But again, it's really up to your loved one as to where they are in their journey and whether they have insight as to whether they have a problem or not. So I'll start my story by saying the dark brown splat marks are still on the white ceiling. They're reminders of more chaotic days, flying coffee grounds, sleepless nights, shouting in the driveway, for a 4-month self-inflicted voluntary confinement, Satan's burning face on the blank wall. These were definite days of mania, hallucinations, anxiety, conspiracy theories, and paranoia leading up to our loved one's hospitalization. After almost a decade of living with behavior that we knew were signs of deteriorating mental health, our son had become harmful to himself and us. We leaned heavily on NAMI support groups, educational programs, hoping to find answers to what we were experiencing. In the end, we understood that we had to come to our own crisis point, and that the support was really about accessing resources and accepting comfort in others who have been or were going through the same thing. We also were challenged by our son's lack of insight about the state of his own mental health. He'd say that getting help was a sign of male weakness, and that we were really the ones that needed the help. This was a difficult time. We were concerned for his safety, but to continually pressure him to seek help wasn't going anywhere. So we were using tough love to drive him. We could seek help, but using tough love to drive him out of the house and onto the street didn't seem to make sense to us either. Because at least he was under the same roof. We could keep an eye on him, and he wouldn't be further away from what the support was that we felt he needed. So we were continually making adjustments to maintain peace in the household. There were also other dynamics. Being a couple, my husband knew the behavior we were seeing wasn't normal, but really wanted to protect our son from societal labels of any kind. Whereas for me, being from a family of teachers, counselors, and social workers, my urgency was that he needed to be assessed, and be assessed now. The day our son got help was not the way we envisioned it. After 72 hours of mania and shoving his father to the ground the night before, we gave him an ultimatum the next morning. Either get in the car to go to the emergency department, or we'd call the police to do it. And he chose the police. We'd forgotten that he had already been associated with our address on police reports, so they arrived prepared to take him into the hospital. After several hours in the ER with security outside his door and us in the waiting room with a very supportive NAMI friend and volunteer, he was finally checked into the Behavioral Health Center in Hilo and stayed there for 3 weeks. In our world, the healthcare providers were the heroes. A long-acting injectable was among the list of medications he was prescribed right while he was there. The first 2 weeks in hospital, he refused to see us, but we still showed up daily during visitations. Even if we were turned away, we wanted to let him know that he was loved. By the 3rd week, the long-acting injectable, along with other medications, began to silently heal his mind. We were allowed to see our son one person at a time. We kept the talking to a minimum and our visits short. The medications were helping us have a relationship with our son once again. When he was ill, he didn't have any interest in communicating with his siblings or relatives, even though they'd make many attempts to reach out to him. The cards, gifts, and letters that sat unopened, and then slowly over time, they stopped arriving. Our son was not a part of significant family events like births, weddings, or funerals. Life went on as if he wasn't alive, and I grieved his absence. A few months after his hospitalization, the world started slowly coming into focus for our son. He started taking his meds without being reminded, was diligent, remembering to go to all of his appointments. He started to show empathy and the ability to actually feel emotion, which had all but disappeared over time. The following Christmas, he bought a beautiful sweater for me and gave his dad a birthday gift. He got an iPhone and slowly started texting his siblings, responding observantly to pictures of his new nephew. A family group chat was formed, which included him, and he responded to. His sister flew out with her partner to see him. It had been 12 years since he had last seen her. He proudly showed them around the yard and fed them a hot dog lunch. Like a flower blooming in lapse time, he was starting to re-enter life. After celebrating many positive changes, the harsh reality of recovery started to set in. Our son, who was an avid waterman over a decade ago, swimming, paddling with a canoe club, surfing, deep diving, and was finding it a challenge to take up all these tasks again. He asked his dad to take him to the waterfront with his one-man canoe, and after several attempts, he realized he didn't have the lung capacity or the strength to keep it up. He found pole fishing off windy escarpments to be an absolute chore and very frustrating. But he decided to swim once a week at the county pool to build strength. He sold his canoe and bought a surfboard, which he'll try out in a few months. He joined the clubhouse in Hilo, which is an opportunity to build up his social skills. And it's a place for people recovering from mental illness to do just that. He's been practicing taking the bus into town in anticipation of his 2 days a week there. One day he looks forward to having his own place. What's different is watching him evolve and try things with a sense of purpose. The world has changed without him actively engaged in it. So he needs to sharpen his acuity when selling things on the internet and identifying chatbot scams. But he's deliberately reaching out to his siblings. It is all part of his social development, and that skill is still in progress because on their end, they have to start coming into grips with the fact that he is in recovery. This is all very new and trying to find the words to patch up relationships. But what is important for us now is having a solid recovery team. And I can't emphasize how important this is. This is a team of a psychiatrist, a counselor, case manager, his primary care physician, pharmacist, supporting him each step of the way. Thank you so much.
Thank you, Brooke, for being here in person and for sharing with us. I really appreciate it. She's on the West Coast right now, so she's an ocean away, but thank you very much. I'm going to go ahead and share my screen and share some of the peer stories, which I have two of them, but they've been pre-recorded. So the first one I'm going to share is Lee's, and then we'll open it up for questions afterwards. Okay. Oh, I don't think I pushed share sound. So sorry. Okay, now.
Hi, my name is Lee Nakahara. I'd like to share my story about recovery with long-acting injectables with my paranoid schizophrenia. I was diagnosed with paranoid schizophrenia in 2004 at the time of my divorce and my first marriage. I was put on 3 milligrams of Risperdal to stabilize me. I lasted about 14 years on that medication. Then I lost my job as a security guard. I stopped taking my meds. I began to drink alcohol and smoke cigarettes. I became belligerent and got my TRO'd by my parents. I was living with them after the divorce. I became homeless. I was arrested 33 times and placed in OCCC intermittently from 2018 to 2019. Once the courts found out I had mental illness, they sent me to Hawaii State Hospital. I spent 2 weeks there. As soon as they put me back on my 3 milligrams of Risperdal, I was fine. I graduated to Kahimohala. I stayed there 3 months. I stayed there. Then I graduated to a group home in Waianae. That's where I was given the long-acting injectable. At first, it was administered by Dr. Kuyanagi at IHS, then Dr. Smith at Waianae Coast Comprehensive. To this day, I swear by the long-acting injectable. When you're not trusted to take your own meds, or you forget it's better for you, today, Care Hawaii administers my long-acting injectable. Side note, when I first started taking the long-acting injectables, I wasn't afraid because as a security guard, I used to patrol a clinic that administered these. It was normal to me. At the time I was taking the 3 milligrams of oral medication, I thought I was doing good. Now I'm doing great. On the orals, I was never able to handle a spouse, volunteer work, a son, yard work, and other physical labor. My life has changed dramatically since I started taking the long-acting injectables. Of course, at first it took a while for the shot to get into my system or on board. So for a while, I still had a lot of breakthrough symptoms. I get my shot every 3 weeks. We kind of can tell when the shot starts to wear off. I start to get an attitude and say, you know, the problem with you, to my wife. Then we go in and get my shot. But lately, things have been going good so well. Sometimes the pharmacist needs to remind us that it's time to get my shot. That's why my favorite Avenger is the Hulk, because he gets angry. My psychosis makes me angry. And that's my story. Thank you.
All right, we just heard from Lee. Lee's over on the Big Island, and he wasn't able to join us today, but I'm thankful that he was able to record his story. And then now I'm going to show you guys a little clip from Cody, which Cody was just at our conference last week on Monday, and he was an incredible speaker. And here he talks about his experience with the long-acting injectable.
Of different antipsychotic medication, and it was a lot of trial and error to try to find what worked best for me.
Oops.
It wasn't until a year or two ago that I made a switch to a long-acting injection. For those of you who don't know, a long-acting injection is something you can take instead of daily oral antipsychotics. It did take me a long time to first try an LAI, but I was on a monthly LAI for quite a while, and the recent update is I switched to a 3-month LAI injection, which means instead of going in to get an injection once a month, I go in every 3 months now. I think it's really important when talking about medication to remind people, especially patients who might be watching this, medication isn't always a cure-all. A lot of people still have breakthrough symptoms with medication, and that's the case for me. Even with the medication I'm on now, even though I have very little symptoms, I do still have symptoms. And I do experience some negative and cognitive symptoms as well. My next video that I'm filming is actually about all of my negative and cognitive symptoms, not just what I experience now, but what I experienced before I was medicated as well. There are a lot of really amazing medication options out there, but for me, this has been the best fit. As many of you know, I don't talk about brand or dosage when I talk about medication because I want patients to work with their care team and their clinical care team to find what works well for them. A lot of people see how high functioning I am and they'll think that if they can duplicate my medication, they'll have the same result. And unfortunately, that's just not how brain chemistry works. That's not how medication works. Everyone has their own experience. Now, for my personal journey, I have had less side effects and less symptoms. So before medication, I was pretty much having constant hallucinations, delusions, and paranoid thoughts. After I started daily oral antipsychotics shortly after my diagnosis, it gave me more clarity, but I was having a lot of side effects. I was still struggling with an increased amount of auditory and visual hallucinations back then, but after working with my psychiatrist for years, I finally found a good mix of meds that allowed me to be pretty responsive throughout the day, but it also reduced the symptoms I was having. So I went from having auditory and visual hallucinations, delusions, and paranoid thoughts constantly just to having some breakthrough symptoms of auditory and visual hallucinations. My delusions and my paranoia pretty much went away. Now, that doesn't mean that I don't ever struggle with those issues, but it's something I don't experience much thanks to medication. And this was all before my current medication. This was already seeing improvements. I was already doing better. I was already gaining insight and finding stability. And at this point, you know, when I was starting to make content and I was starting to do my advocacy and travel around, I was still having symptoms maybe a few times a week, which may sound like a lot, but from going to constant symptoms, basically whenever I was awake, I was having symptoms, to having symptoms a few times a week for a couple hours, it was a really big impact and it was a huge difference. And so for a while I didn't change my meds because it worked and it was allowing me to have more freedom, it was allowing me to have less symptoms, but like I said, I still had some side effects. I had a lot of issues with weight gain. One of my medications even gave me tardive dyskinesia, which is a movement disorder. Fortunately, as soon as I quit that medication, I stopped having those side effects. So I did struggle here and there, but overall my life was improving, it was getting better. Once I started my LAI, I went from having symptoms a few times a week to a few times a month. So now, because I do travel a lot and there's a lot of things I've had to consider with how often I take medication and how much of an impact it has on my life, I've been really fortunate that I do have less side effects and now I'm having less symptoms too. This has been really great for me as I travel. I talked about this in the very first video I made about transitioning to a long-acting injection. I was very hopeful that it would lead to less symptoms over time, and that's what I've seen in my own experience. I've been really grateful because aside from just having less symptoms and having less side effects, I've been able to be a little more functional day to day. Once again, I want to remind everyone watching that this is my own experience with medication and
Awesome. So we just heard from Cody and Lee. So those were my two peer stories, and which leads us to the end of our webinar. And I want to say that LAIs are not for everyone, but everyone deserves to know they exist and have a choice in their care. So with that said, I'd like to open it up again. There's any questions for Brooke or for me or for Kaylee before we say goodbye? Jenny, I see you unmuting.
Yeah, can I ask a question?
Yeah.
Cody said he gained weight from the LAI and he changed to something else. Do you gain weight when you do take LAI?
I think it's like with every medication, like even when I started on antidepressants myself, then I had to try out like 3 or 4 different antidepressants until I found the one that was right for me. And some of them made me gain weight, and some of them made me feel a certain type of way, and I had to figure out what um, side effects were worth it for me. Like, okay, this antidepressant is working. Does that mean I can accept the side effects that I have with them? And I think it's the same with the LAIs. Like, the different ones are going to cause different kind of side effects, and you got to see how it's working for you and decide if the side effects are worth it or not. Brooke,
Yeah,
do you have anything?
yes, yeah. I'll piggyback on what you were saying. I um I think that makes um life a little bit more difficult for especially someone like our son who was very active, athletic, had a good physique before he got sick, and to all of a sudden gain a lot of the massive weight in his belly. It was important for us to um, just make sure that that he had a healthy self image in spite of it, and the fact that he wanted to exercise in the pool and things like that, which showed us that he was dedicated. And he's starting to watch what he eats. That he's becoming more interested in making some changes to help combat that. But it's a steep road, because you're dealing with those meds that are creating it. Also, he has what's similar to a Parkinson's shake. Now, his psychiatrist has offered another drug to help out with that. He doesn't seem to be interested in taking another drug. I think right now he can navigate it through life with it successfully, and it's not impeding anything that he's doing in his daily life. So until he finds that it's something that's really getting in the way, like let's say he's teaching or something like that, and it becomes a little bit of a something that gets in the way of whatever he's doing, then he might look at it. But right now he doesn't seem to be interested in taking another medication to quell those tremors.
Thank you, Brooke.
Hello?
Go ahead.
Can I ask a question? Yeah, my name is Ganesh, and this is about our adult daughter who is 48, married with an 11-year-old son in San Jose, California, having this, uh, you know, bipolar disorder for the last 10 plus years. The last year has been really difficult. She ran away from home, staying in hotels after hotels. The challenge for us is she has gone through medications, quit it, and she doesn't want to take medication at all. She doesn't even want to see the doctor, psychiatrist. She sees the doctors for all the physical illness. So how do we get someone who is paranoid, schizophrenic thoughts, everything that we just heard going on through her, denying it and doesn't want to take medication, period? If I bring it up as a father or if her husband brings it up, it just creates a huge, I would say, a trigger which kind of blows up. So how do we take care of our loved ones? Should we be patient, or should we keep on harping about it, or should we just wait for the patient, the loved one here, to get insight and turn around?
Brooke, I'll let you go and then I'll share.
In our situation, it took a crisis. And when something, over years and years of lack of insight and refusing help, and not realizing how severely his mental health had deteriorated, it finally came to a head, and the police had to take him in. So that was the blessing in our situation. Until then, all we could do was just to give him as much love as we could, and provide meals and a caring, supportive environment. But in our case, it had to reach a crisis.
Sorry,
So
go ahead.
So at NAMI, we teach, it's called the LEAP method: listen, empathize, agree, and partner. And that's kind of what Chris talked about that Dr. Chad did with Amy. So you're listening to what they're saying. What are their complaints? What's going on? What are they struggling with? You empathize with that. Oh, that must sound really hard. And then you find something to agree on. Like, maybe they agree that they're also having trouble sleeping. Maybe they agree that they want a safe place to sleep for the night, or you find something to agree with and then you partner on it. Okay, well, let's make it a doctor's appointment together and let's try to find a medication that's going to help you with your sleeping. So finding something that you can agree on and partner with makes all the difference. And then also the provider makes a big difference. Chris talked a lot about the trust that Amy has with Dr. Chad. Dr. Chad showed up the first time and Amy said, no, absolutely not. I'm not going to take that LAI. It took 2 times for her to finally say yes. And he went into it knowing that. And I think it's important that we go into it knowing that, they might say no multiple times, but we have to keep trying until they say yes. And it's the same with our system. Our system, it's broken. It still has a lot of gaps and a lot of holes, but we have to still keep using and engaging in it to show where our gaps and holes are so we can work together to fix it. So I think finding the right psychiatrist makes all the difference, and that trust that psychiatrist builds with your daughter can be really helpful. And also, I recommend you read the book I'm Not Sick by Dr. Xavier Amadori, which I can send you the link for it afterwards because it goes over the LEAP method and what it actually looks like to do. Anything else?
Sorry to interrupt. Yeah, I did. In fact, I tried everything. I did read the book, tried the LEAP method 2 years ago. I thought there was a window of opportunity, which was a blessing. But again, it went back to the same thing. Going back to the system, she has been admitted to hospital forcibly many times in California. Police have come and taken her. They don't be added to her trauma to the extent that if you call 911, that scares the hell out of her and she runs away. So I'm sorry, we tried everything, but the system is broke. I agree with that. In December, he was in Kaiser for 3 weeks to treat her congestive heart failure situation, which we ignored. And they tried everything to convince her to do psychiatric evaluation and medication. Finally, they said, your daughter is an adult. She refuses to take medication. She looks okay. I mean, she's very smart in convincing them that she's fine when they talk. That's the problem. She herself is a physician and a psychology major from Stanford. So she really tricks the system and people because she doesn't want to be there. So I'm sorry to take time, but this is our frustration. Yeah.
No worries. It's very frustrating. And so we do have another guide that's about to come out. It's called Navigating Crisis for Families. So it talks about ACT, assisted community treatment. So that might be a potential option for you. And so what I would recommend is you just gather as much evidence as you can right now. Just unfortunately, our system likes data and our system likes evidence. So just start collecting data and evidence, video if you can, write down records of like this happened at this time on this day, because we know that when they show up in front of a mental health professional or a police officer, that they can answer the questions in the way they need to get what they need out of that situation. They're very, very good at it.
Very good at it. Yeah.
It's important that you start to take data and make records so that when those situations arrive, you have something like, nope, this happened on this day and whatever else. So yeah, when that guide comes out, take a look at that. We talk about ACT and guardianship and all of those things, which those processes are not easy to do either and are also very difficult. But I think it's just important to educate yourself as much as you can about the different pathways that could lead to better outcomes.
Okay, thank you. I'll do that.
I just wanted to ask, is everyone familiar with 988? Okay, so 988 is different from 911 in that you have, at least in the state of Hawaii, and I know they have it in other states, an opportunity to speak with someone who's very familiar with dealing with a person who is either suicidal or who is experiencing psychosis. And and being off medication and whatnot. And they also offer very good support to those people who are trying to care for those loved ones. So if you're ever in a situation that is, getting difficult, you can certainly call 988 and ask for some support.
Yeah, and you can request a CMO, which is a crisis mobile outreach. And so if your loved one is saying like, no, I don't need it, I don't need it, you yourself as the individual and family member, you can call 988 and say that you're in crisis and you need them to help to manage your loved one who has a mental health condition. And they can dispatch a CMO to you to help with that. And sometimes that CMO, they'll give like 45 days case management. And sometimes that maybe that CMO can help to make that trust and relationship so that your loved one will take that LAI. It really is just one person that comes in that they trust and that they want to say yes to. And sometimes it might take multiple people before you get there. Like they might have to see 5 or 6 psychiatrists until you find the one that they're going to trust. Like Chris talked about, he went to every single psychiatrist on the Big Island and he could not find somebody to help him. And finally he found somebody. It sucks, but as family members, we have to be persistent and keep advocating in order to get the outcomes that we want. And unfortunately, it takes many, many times sometimes to get there.
Also, if you have to call a law enforcement for support, then, and of course that would be 911, you can request an officer who has been trained in CIT, which is the Crisis Intervention Training. We're actively working on this on the Big Island, and with our officers, we've trained over 25% of the force to date. And there are other jurisdictions where officers are trained to arrive on the scene of a situation where there is a mental health crisis, a person is in mental health crisis, and learn how to effectively diffuse the situation without resorting to other more lethal means. So these officers are trained. When we called and I asked dispatch for a CIT trained officer, unfortunately at that point, she didn't even know what CIT was. And now for those folks who are on the Big Island, everybody is aware of it. And there are more officers than not on duty who are trained. So just a bit of that advice.
Thanks, Brooke. That's super helpful. Any other questions? All right. I just want to say thank you to our storytellers today for sharing so openly and for helping us better understand the real experiences within our crisis continuum. Your voices are powerful and they help shape how we support one another and how systems can improve. And thank you to all of you for being here, for listening with openness, and for being part of this community. These conversations are how we reduce stigma and create change. This webinar was recorded, and so it will be available on our website. I'll probably also send it out to our family support group list. So for anybody who wants this information, they have access to it. Again, the reason why it's so important for me to do this webinar is because I had no idea that LAIs existed. And if I would have known, I think it could have changed my life and my mom's life as well. So again, thank you all for being here, and I hope you have a great rest of your Saturday.
Thank you, everyone.
Thank you, Anissa. Thank you.
Thank you.
Thank you, Kaylee.
Thank you.